Meet twins Peggy and Lauren. They're 37 years old, work at the same company, and are ready to choose their health insurance plans during their company's open enrollment. This year, they have 2 PPO plans to choose from, an HSA compatible plan or a traditional plan. Both offer the same network of doctors. The HSA compatible plan saves them $250 in monthly premiums, but has a higher deductible. It also comes with a health savings account, or HSA, which they can fund pre-tax. The bank account comes with a debit card that is used to pay for qualified medical services. The HSA stays with them even if they change jobs. Peggy and Lauren each choose the HSA compatible plan for different reasons, but they are both happy they can stay with Blue Cross Blue Shield of Michigan. And because they are with Blue Cross Blue Shield, they will pay negotiated rates that are often lower than the full price for services. Let's see how their attitudes and behaviors affect how much stress they feel in their first year in an HSA compatible plan. Peggy is the planner. She plans for her future by keeping an active savings account and contributing enough into her 401k to meet her employer match. She chooses the HSA compatible plan because she understands the benefits. Lauren tends to go with the flow, even when it comes to financial planning. She chooses the HSA plan because many of her coworkers did, and she trusts their opinion. Their employer asks them to set up their HSA contributions using pre-tax deductions from their paycheck and starts things off with a small monthly contribution. Peggy thinks about her future needs and puts the $250 she is saving each month on premiums into her HSA. Lauren doesn't fund her account. Instead, she puts the extra cash toward a new car payment. In January, they get their HSA debit cards. They each visit their doctor for an annual wellness exam. Because the visit is preventive, it doesn't cost them anything. During the exam, the sisters find out they'll need a monthly medication. Peggy has enough money in her account to pay for her medication this month. Lauren doesn't, so she has to figure out another way to pay. In April, both sisters get similar injuries and see doctors who want them to have MRIs. Peggy read her plan benefits and knows she'll have to pay the full amount for the MRI since she hasn't met her deductible. She asks her doctor if the MRI is necessary. It is, so she shops around to find the best price. Luckily, she can cover some of this cost with the money she has in her HSA. Lauren, looking for convenience and not thinking about the cost, heads to the nearest facility. She's a bit shocked by the bill since her previous plan had co-pays, and she never really paid attention to the actual cost of services. Throughout the year, the sisters need follow-up care and medications to recover. Peggy knows that she has to pay the full amount for these services, so she continues to shop around for the best value. Because Lauren has been paying more for care than Peggy, she meets her deductible first. Once their deductibles are met, they'll pay 20% for their services according to their plan. In November, Lauren decides to take a job with a different company. It only offers HSA-compatible plans. Based on her experience last year, this causes her quite a bit of stress because she hadn't learned the best way to use her plan. She didn't put any money into her HSA, aside from her employer's contribution, and didn't get any tax benefit. She didn't research her healthcare options, so she spent more money for the same type of care that Peggy received. Peggy's first year with an HSA was less stressful than her sister's because she figured out how to make her plan work for her. By making regular contributions and shopping around, she was able to pay for most of her healthcare expenses with her HSA. She even has money left over for next year. She also knew her contributions would get tax benefits, so she put in as much as she could. When Lauren learns about how much better Peggy's experience was, she makes the decision to do some things a bit differently next year. In the end, HSA plans are a way for you to be more involved in your healthcare. By funding and learning how to use the HSA, you can make the most of your plan. Want to learn more information about health savings accounts? Visit bcbsm.com.